Hi, everyone. I'm Dr. Becca Boronat, a veterinarian with the National Shelter Medicine Team with Best Friends Animal Society. And welcome to today's webinar, where we're going to be talking about infectious disease outbreak response in animal shelters. And this is really part of our, we just reviewed, updated our playbook. So this QR code is going to take you there. And also Mel is going to be sharing on like the links to our playbook, to the disease outbreak playbook on the chat here. So feel free to follow there if you want to. This is going to be really a conversation about the playbook and all of those basic steps for managing outbreaks, what is important for us to be looking at, what we should really pay attention, what are the quarantine periods, what are incubation periods, like what are those things that sometimes we hear people talking about, but we are not sure. So we're going to talk about some definitions. And we know like outbreaks are one of the most difficult challenges we face in shelters. They can be like we all can feel super overwhelmed. It's emotionally exhausting. Everybody who has been throughout an outbreak know how hard it is. We do our best, we work so hard, but it's not always that we have the outcome we are looking for. How many, all those animals that we care dearly, that we really love, and we put so much effort to care for them, sometimes we end up losing them. So definitely it's draining. And when we are talking about disease outbreak, this is going to be mostly about the animals, but we cannot forget the impact that it has on staff and how important it is for us to be caring for our animals, but also to be caring for each other. We really, throughout an outbreak, we need to give attention to our staff. That was one of the first things I've learned on the largest outbreaks I did, and one of my first ones. It was like I remember like the person who the consultant that was helping me at that point keep telling me, what about staff, how staff is doing, i.e. like how we are supporting staff, and definitely it's key. So just keep that in mind as we are going through this presentation. So as I said, we updated, and this outbreak, and this session is going to walk us through it. The goal of the playbook, the goal of our presentation is to empower you with shared language and framework. So no matter your position, you know how to contribute to a calm, effective response that protects both animals and people. And as I said, just follow the QR code here so you can get access to our, and it's not going. There we go. And remember, disease prevention, it's everyone's job. Every animal, every minute, every team member, no matter where you are responsible for preventing disease in your shelter. You're not going to be treating them. You're not the vet, but or the vet care, or whoever is the person who is in charge of that. But definitely there are some steps that we can do in a daily basis to really prevent us from transmitting disease from one animal to the other. And before we go any further, I really want to say thank you to Amanda. She's our vet tech. And this is her picture here in a CIRD response that we did in Texas, the beginning of the year. But it's really thank you. She was a huge, she did most of this review. She worked really hard. She just likes to be in the back of the house and not show her face as much as I do. So she decided not to be part of the presentation, but really she is a big part. She's really responsible for this, to getting delivery on time for you guys. So here's what we're going to be talking about. We're going to be talking quick introduction about outbreaks. We will look at risk factors, the conditions that make outbreaks more likely to happen. We will review diseases that are commonly associated with outbreaks in animal shelters. And the big piece is going to be steps to manage an outbreak, giving you a clear response roadmap from the first sick animal to returning to normal operations. We will talk about sanitation and biosecurity. And finally, we will wrap up with prevention. Because the best outbreak is the one that never happens. I do love outbreaks. I do love this response, but definitely I love to work on this. But definitely, if never happens, I'm going to be much happier with that. So, and here, this is Franklin. It's Dr. Aaron's dog, a survivor of a distemper outbreak that occurred in a temporary emergency shelter during Hurricane Harvey response. And Houston was flooded for weeks. Everybody who remembers knows how serious that hurricane was for Houston. And it's because of animals like Franklin that we are so passionate about outbreak response. For all of the shelter animals, for those displaced by crisis, and for those who were euthanized when the population was recommended as a form of disease control. We dedicate this presentation to Franklin and to all others who were just as deserving of a chance to survive. Outbreaks of infectious disease in animal shelters can dramatically affect life-saving. In short term, both infected and exposed animals may be at risk depending on the shelter available resources, right? From a long-term perspective, the presence of infectious disease can impact on the shelter's reputation in the community with partner organizations, and definitely it limits life-saving. The good news is that there are steps that shelters can take not only to prevent outbreaks, but also to respond to them and save more lives. And perhaps the most importantly, shelters don't have to do it alone. There are experts and resources available to help everybody out there, like this playbook and our team. If you are dealing with any outbreak or you think you may have, or if it happens in the future, just reach out, right? We can assist you in managing an outbreak and again, saving more lives. And this is the QR code to reach out to us. Just follow that one. So the main risk factor for infectious disease outbreak in animal shelters are overcrowding and length of stay. As the average length of stay increases and outcomes do not keep the pace with admissions, the shelter population, the density increases, contributing to high incidence of infectious disease. With the animals getting sick, they will require medical care, what is going to delay animal flow and lower the likelihood of adoptions. Fewer adopters want to adopt or to bring home, right, a sick animal. They don't present well, like they just don't, it doesn't click. So in some shelters, really have medical holds or like just hold them until they are fully recovered. With it, what in most cases we do not recommend. It's really like get them out is the most important thing. But as a result of that longer, like the increased length of stay, overcrowding, it just compromises welfare across the board. And just like that, it becomes a vicious cycle that requires prompt intervention to reset and improve animal flow and life saving. So it's really, they are staying longer, you start getting overcrowded, they get sick, and then they stay longer because we are treating them, and then we are delaying outcomes. And that is going to just, again, increase even more length of stay, overcrowding, and it just goes on and on. And then when that is happening, we need to do something really quick about it. And this graph is just a study on URI in animal shelters and suggests that shelters must focus all efforts to minimize length of stay in the shelter by increasing adoptions, return to home, and expanding foster homes. This graph in issue 1, and what it shows is that the cumulative probability of a cat of developing URI by day 7 of shelter stay is approximately was around 30%. By day 14, it's risen to 84%, from 30 to 84. So when we're thinking about length of stay, we really need to think about having it less, like those 7 days, less than 14 days for sure, because it just increases exponentially. And this second graph here shows the probability of cats developing URI on a particular day of the shelter stay. So it just, again, it's this one, right? How it increases, right? At the beginning, it's kind of, it really right as they get in, they have high probability, decreases a little bit, but see how it goes from day like 6, 7 how it starts increasing and increasing. So it's very important for us, again, to try to minimize the length of stay as much as possible. And these are characteristics that will guide outbreak response. Incubation period is the time between initial infection and the onset of clinical signs. Pathogens are really the bugs, right? Like viruses, bacteria, fungus, the ones that are causing disease. Shedding period is the time frame during which an infected animal can release or shed the pathogen into the environment, potentially infecting other animals or even people. Some pathogens are hardy in the environment, so require extra efforts for sanitation and PPEs, like use of personal protective equipment. Canine parvovirus, feline panleukopenia, and calicivirus all fall into this category. Healthy appearing animals can be contagious. So we cannot assume that just because we don't see a clinical sign, it means that that animal is healthy and we don't need to worry about biosecurity. What about this? Just like, if anybody wants to answer on the chat, yes or no. What do you think? Should I take selfies, kiss and hug all the cats in my shelter? Any guesses there? Should I be doing that? Shouldn't I? I wish I could see everybody's face at this point, like, because it's very interesting what happens here. But it's really, I really want to say yes, right? Like totally. But the answer is no, we cannot do that. And that is really because we are fomites and we don't want to be fomites, right? Fomites are just like, it's an object surface, like our hands, our faces, our clothing, leashes, petting, anything that comes in contact with the animal, and maybe carrying and spreading infectious disease between other animals, or even, again, between a person to an animal. So we should avoid doing that. It's hard. We all know it's really, really hard to not do that. I want to kiss them all, but I really don't do. When I'm visiting shelters, everybody knows I'm not like, we all of our team, we always have gloves. We always like really try to minimize as much as possible disease spread. So and we play with one kitty or one dog at the end of the day, just to make sure that we are, having that fix. So let's remember to limit that contact. And one more thing, we can give them love, right? We can give them love with our eyes, with our voice, just talking with them. They pay attention, and that gives a lot. But we don't need to put our hands, our faces, or even our scrubs, like to be sharing disease. So this chart, which is also included on the playbook, provides a side-by-side comparison of important characteristics of the common infectious pathogens found in shelters. Understanding these elements helps us making informed decisions of the type of the response required. So let's walk at one example here. It's going to be like distemper, canine distemper virus. Incubation period, as we said already, we gave you the definition already, right? Like incubation period is that period from exposure, from the animal getting infected to when they start showing clinical signs. For canine distemper, it's 14 days. It means that the dog may not show any clinical signs throughout those 2 weeks. And this is important because, so just to go back to that idea that like dogs that may be healthy may be already like developing the disease, and some will maybe shedding the pathogens even before showing any clinical signs. Right, the transmission of distemper virus is spread through aerosols, like when they are sneezing, when they are coughing, direct contact, animal to animal, nose to nose, feces, urine, and fomites. And makes it, all of this combination, it makes canine distemper virus highly contagious, especially in shared spaces like kennels, play yards, exam rooms. So we need to make sure we are deep cleaning kennels when we bring in new animals. We are disinfecting in between animals, like our exam tables, microchip scanners, scales, and so on. Shedding. Dogs can shed the virus for weeks, even after clinical signs appear or resolve. But this is a problem is this a problem, right? Like, what do you think? Like, if they are shedding for months in some cases. We're gonna go back to that. Just remember, it's not because they are shedding that it is a problem, and we're going to explain that when we talk more about distemper virus in a little while. Diagnostic testing. Typically, what we're going to use is the upper respiratory panel PCR with a PCR test, right? Like we're just going to swab upper respiratory areas and really just send out that to the respiratory panel to be run. But it's important to know what PCR does. It detects a virus genetic material. We're going to talk a little bit more, but it's detecting that there is a genetic material in that sample. And sanitation for distemper, it's really like this is the kind of virus that doesn't last too long in the environment, right? Like it's not very durable and it's easily destroyed by just basic disinfection. Routine clean protocols are usually effective to destroy it, and which is a big difference between distemper virus and parvovirus or Panuc virus or calicivirus. Remember, those that are hardly in the environment, those can persist for months in the environment, and we need to be extra careful when we are doing our cleaning and disinfection, and we're going to talk more about it. And big picture takeaways from this chart that is available for you guys, as we said, right? Incubation period affects how long exposed animals must be in quarantine. So it's like those animals have been all of this row of animals have been exposed to distemper virus. How long do I need to keep them here, right? Those animals are going to be quarantined for 14 days because it's that period from getting exposed, infected to developing clinical signs. Transmission routes, which helps helps like really guiding PPE usage and sanitation protocols. What kind of PPE do I need to use? What kind of protective personal equipment? Gloves always, right? But depending if I'm handling a cat, if we're talking about ringworm, if we're talking about let's say Bordetella bronchoseptica, those are going to differ. It's going to be different how I'm going to handle those infected animals. Then the shedding period affects how long the animals must be isolated. I'm going to talk about the difference of isolation and quarantine in a little while. But the idea is incubation period, before they get sick, we need to quarantine them. Isolation is the time where we know they have clinical signs or they tested positive and they're going to be separated from the general population or isolated in place. And sanitation, diagnostic tools, as we said, like there are four. The most common one is really PCR. It's the one we're going to do mostly, but there are some cultures, there are some in kennel side testing. Sanitation needs, it ranges from one deep cleaning to maybe repetitive deep cleanings just to ensure that we are covering every corner of the enclosure. Let's say when we do deep cleaning for parvovirus or for panleukopenia virus, a lot of times like you see people say, no, you need to clean 3 times, you need to clean 4 times, you need to clean 2 times. You need the idea is not that if you cleaning once perfectly, once is enough. But how likely are we to really clean an enclosure perfectly? Very unlikely. So we do clean 2 or 3 times, one after the other. We don't need to wait time in between them because it can last in the environment for months, even a year. So the time that we are letting it sit there without any animal doesn't say anything, doesn't help in any way. So it's really about the cleaning process. So if we do 2, 3 times deep cleaning before getting another animal into that enclosure, we are doing that to really make sure that we are getting every single corner, every single crack, every single area that we have there. Understanding like these differences help shelters apply the right level of response for each pathogen, neither under-responding nor over-isolating unnecessarily. Like canine distemper, for example, needs isolation and population management, but not panic because good shelter-oriented disease prevention practices help limit the spread. Biosecurity. making sure we isolate. There are different things we can do. So if you do, like, again, this is going to be available for all of you, like this chart is ready to go. So what are the steps, right? Like, because this is where this thing gets, that's the guidance, that's the roadmap you really need, right? You need to identify the problem. That's the first thing. Do I have a problem or not? You need to ask for help. Like, just do it. A lot of, like, we have a list of them on the playbook, and I'm going to present in a little while. We need to diagnose the pathogen, right? We create a clean break, separation between new animals, exposed sick animals. Communicate. We need to communicate to stakeholders. We need to isolate sick animals, with a few exceptions. We do need to quarantine exposed animals. We need to perform risk assessment of those exposed animals. We're going to clear animals that have been exposed and didn't develop clinical signs within that incubation period, or the ones that are just recovering from it, and we will return to normal operations. That's the best part and most exciting. The time waiting in between, it can be very, very stressful and overwhelming. But please know that canine pneumovirus and canine influenza virus, both of them will not follow these steps. And we are not going to address this here. But if you do suspect that you have like pneumovirus or influenza virus, you need to know that this is going to be a completely different approach. And reach out to us, reach out to any of the resources we're going to provide you a little bit in a little while. So this first step, like really identifying what is the problem, right? You need to isolate those cases. What happened? Like, how do you know you are having an outbreak? What is the trigger? Is it one case? It's 50 cases? Are 50 cases? Like, what is the reason? Like, why? When do you decide that, oh, I do have an outbreak? And it will depend on your shelter, but there are a few guidelines here. More animals affected than normal. Every year I have 4 puppies with parvo, and now I have 26. A rapid increase of an incidence of a disease. I have 2 dogs coughing yesterday, and now I have 25. And the next day you have 45, right? Animals with clinical signs that are more severe than usual. Calicivirus. I always treat with doxycycline. It's like they get better, but they are not getting better, and they are getting worse really quick. It's not doing the trick, right? And unexpected diseases, right? Like something that is totally out of the ordinary. A disease you think it's kennel cough, and it's not presenting as like the initial presentation it is, but then it just becomes a pneumonia 2 days later, and like it's really not presenting. It's not really what you expect. So the clinical signs are much different. So those are the main reasons, right? Like that you say, oh, maybe I have a big problem here. And some shelters will not be aware. Am I having more or less? Is this my feeling? Like I remember, like last year, we were like all talking about how we felt that we were having that there were more panleukopenia happening everywhere, just because there were so many. We were dealing with so many shelters, but we didn't have like a baseline of all those shelters in previous years. So was it more, or just because they were reaching out to us? We don't know. The only way to know is really like we need to have our diseases. We need to have a routine disease surveillance. We're going to talk a little bit more later, but that's how we make sure that we know what's happening and how we prepare also for each season, right? Initial immediate steps, once there is a concern that we may have an outbreak, include halting all movements between areas of the shelter and pause admissions. We're going to talk more about that. So step 2, ask for help. I said that already a few times, and I'm going to continue saying, you don't need to go through this alone. Outbreak management can be complicated, and every outbreak is a little bit different. There's always like some things that we need to change and make sure that it's going to be helping that shelter. So each shelter has unique housing facilities, different available resources, financial, staffing, isolation, and capacity and veterinary capacity vary terribly from one to the other one. Even for shelters that work closely with a veterinarian or have a vet on staff, sometimes do not know what to do or use resources really applying strategies that are not aligned with shelter medicine. So it's very important for us to, in any doubt, just reach out, just ask for help. It is, again, is strongly recommended for you to reach out. You can, this is the QR code that you have. You can reach, just follow. Here's sheltermedicine@bestfriends.org. Feel free to reach out to us. But you have the University of Florida, you have Medis Fund, ASPCA Shelter Medicine Services, and Wisconsin are just a few. And the link to access, to connect them directly with them, it's available on our website. And again, on the playbook, you don't need to go through this alone. There are plenty of organizations there to help. And the third step is diagnose the pathogen. Diagnostic testing, while it's resource intensive, it is required to quickly identify exactly which pathogen is involved and to guide the response. Accurate diagnosis can ensure proper treatment and prognosis. It will help identify incubation and shedding period, as we already talked about it, transmission routes, and effective sanitation processes based on the specific pathogen. As we said, maybe we need to clean more, deep clean more than once. Additionally, proper diagnosis can guide strategies to prevent it from occurring again. Delaying testing can lead to ongoing transmission and increased number of affected animals and lives lost. Let's just think about like canine infectious respiratory disease. Like a respiratory panel, a full respiratory panel is indicated, as we also mentioned. Even if a particular agent is suspected, the reality is that no disease can be diagnosed on clinical signs alone, right? Like in the outbreaks, and when you have multiple pathogens that can be causing that disease. And again, it may change how we're going to respond. So the initial testing for CIRD is going to be really the full panel. PCR. And the PCR test is a polymerase. Oh, I practiced that, people like, and it's not. There we go again, polymerase chain reaction. It's a technique used to detect the presence of a specific genetic material. No, from the pathogen, right? You have like the genetic material of a pathogen, of a virus, bacteria. But note that it identifies the presence of the genetic material, but it does not distinguish between live or dead organisms. So it's just saying it is there, but is this an infectious, an active agent or not? It's not giving you that answer. And so that means that a positive PCR doesn't mean that the animal is infectious, and as we said, may detect leftover genetic material. And so we need to correlate the test results with the disease staging, with what we are seeing. Is there clinical signs or no? Is it before? Is it after? What's happening here? So it's definitely like, it's very important to, when we look into PCR, that we are paying attention to that. In outbreaks of feline respiratory disease, while PCR test is available, it is not often necessary unless in very unique situations where you have severe strains that are really causing clinical signs that are different than what we are seeing, or very severe, like you have like animals with clinical signs, with respiratory clinical signs that are dying overnight and things like that. But for feline, so for canine, it's going to be always, but for feline, we're going to have, it's going to be rarely that we're going to do PCR. So just to review what I said here, canine, when we have upper respiratory infection going on, we will always want to do a PCR testing so we can identify what is the pathogen when we're talking about the outbreak. When there is an outbreak, increase in incidence, and so on, that you're not going to do routinely. Now, for feline, we will not do a respiratory panel unless there is a very specific situation for us to be doing. And what is the difference between that? Like, it's because the test result will tell me for dogs will having a positive result will may change how I'm going to treat, how I'm going to manage that outbreak. For cats, most of the cases, it will not, again, unless it's a very severe case. All the cats, like mild and moderated feline URI, we're going to treat the same way. We're going to isolate the same way. We're going to everything. Biosecurity is the same. It's different than if as we said, if I have a pneumovirus or if I have a Bordetella bronchiectasis, my approach is going to be different, right? So just think about that's why. So as in shelters, we always concerned about how many, like our resources are so limited, and we need to really should I spend all of this money doing testing if it's not going to change how we're going to approach? Maybe you don't need to test. Just do the treatment and just follow with your biosecurity measures. So just think about that. Canine parvovirus can be diagnosed with kennel side point of care test, as we mentioned already, right? The same thing goes with feline panleukopenia. And what we need to think about is we can also send a fecal PCR testing if we want to get a more specific diagnosis. But most of the cases, we just follow with the point of care. And ringworm, which is common cause of outbreaks in our shelters, can be diagnosed by fungal culture or also PCR testing. And if we have animals that are dying in our shelters, we definitely, if we find animals that, it's highly recommended for us to be doing necropsy to making sure that we are sending it to, or just it doesn't need to be a super fancy, but maybe just your vet or the vet clinic can, like the private vet near you, can do a necropsy and try to identify some changes that can guide you why those animals are dying in care. And one thing that is important here, but it's not showing elsewhere. It's really that you need to remember, I don't know why it's not showing, but it should be on this slide here, is that not all labs are created equally. We always think there are some labs that we commonly use and we recommend, right? We do have the ones we use is Purdue Animal Disease Diagnostic Laboratory, IDEXX, Cornell, and Wisconsin, Cornell Animal Health Diagnostic Center, and Wisconsin Veterinary Diagnostic Laboratory. Those are the ones that we those are the ones that our go-to because it definitely can be trusted, have quality control, and some specific strategies that really makes us feel confident about them. So just keep that in mind. And I know that Mel is going to be sharing with you guys also one information that we have about the comparison between Purdue and IDEXX, that those are the ones we have been using more. Purdue has been great lately on giving results really quick for us, and timely results are key for us to be able to address better and save more lives. So step 4, create a clean break. So that's key, right? It's really what we want to do. It's really that clean break is to stop the cycle of transmission, where new animals and any unexposed animals must be kept completely separate from sick and exposed population. So it's really aligned. These guys are exposed. These guys have clinical signs. On this side, no one does. Sometimes it's just a divider between really rooms. Sometimes it's really a completely separate building. So we really need to do that. We're going to explain a little bit more. For many of the common shelter infectious diseases, animals can be infectious, as we said already, before clinical signs are noted, meaning that healthy appearing animals can transmit infectious disease. And in most cases, it is impossible to visually determine which animals are infectious and which are not. If a shelter continues to admit new animals to the population, this infection these infectious but asymptomatic animals can transmit disease, and the outbreak cycle will just grow. It is unacceptable to unnecessarily expose new animals to potential deadly diseases. So, to create a clean break, it's important to restrict shelter admissions to emergency only. And this is going to include, like, the emergency only, it's going to include severely injured or ill animals, animals who pose a threat to the public, to like public safety, or they are like their own safety, like a dog that is running on the side of a highway, right? Like that dog is a problem for it's a risk for that dog, but also it may cause an accident, and then it's going to be a problem for the like a community member, or a dog that maybe has rabies, right? A cat. So it's very important for us to keep in mind. We're talking about holding intake of animals that that are non-emergency cases. And there are various ways of achieving this: diverting new admissions to foster homes or to offsite locations like an empty warehouse or state fairgrounds, or maybe divert them to a partner organization, or recruiting finders to become temporary fosters for those animals. We can also prevent admissions through community outreach, like what are the supplies they need to keep their pets, or postpone or reschedule foster appointments, or like people who are if you are managing intake, also you are postponing intake of those animals. But it's really like, until we know what's happening and how we're going to manage that in our shelters, we need to really stop animal flow as much as possible, animals from coming in, animals from coming out. We are not in favor of stopping completely animals getting out. We need animals to get out. There are ways of doing that. But at the beginning, especially until we figure out what's happening, sometimes it's what is indicated. So this is an example of a canine distemper outbreak flow chart. And this is going to be shared with you on the chat, and also it's available on the resources of the playbook. And it's huge, right? Like, but so you don't need to know that by heart, but it's really like it's just to help guide decision making throughout the outbreak. And you can and it's very easy here for you to understand the separation, right, between the separation between the infected animals in red, the exposed animals or recovering animals in yellow, and the ones that are or returning to general population, or all of the ones that are being admitted, the new ones or the ones that haven't been exposed. So it's really like this clean break. It's just really like visually to give you some like a visual on yeah, these are the ones that are clean, that are safe, and these are all the ones that we have that may be carrying the disease. So it's very, very important to create that separation. So this is all the concerning animals, and down here are the ones that haven't been exposed at all, or have recovered and don't have a chance, that are not shedding or not, and don't have a chance of getting sick anymore. Step 5, communicate what's going on. Be proactive, be transparent, not only about the emergency admissions, right? Like that, okay, we are taking animals right now. These are the only animals we are taking. But also, you need to let your transfer partners know that last week they took animals that maybe were exposed to distemper virus. Adopters, the same thing. We don't need to create panic. We just want to communicate about potential exposure, what they need to look for, and how and what they need to do if they recognize clinical signs. And just reach out, right, like to other shelters in the community, because maybe you brought an animal from one of those shelters, and that's maybe your patient zero, and that shelter needs your help. Communication to the public also can include a call to action depending on the needs of the shelter. Request for temporary fosters, right? Make a plea for adoptions, for transfer. You need their help. Make a plea for donations to assist with the response, right? Shelters fear a lot communicating to the community because of backlash or resistance from like transfer partners that may, I don't want to take your animals anymore because they're sick. But transparency, however, will pay off in the long run. Like those shelters that you transfer an animal and they break with distemper, and you knew you had a distemper outbreak going on in your shelter, they will find out and they will not be happy with that and they will stop working with you. So shelters must be transparent. During my first super large scale distemper outbreak, the shelter I was working, they had terrible relationship with the community. There was a blaming, everybody was blaming everybody. As soon as we had like we understood what was happening, we communicated with everybody, press release out, this is what's happening, we made a plea, we told the community we were trying to save lives, and that changed it. It was incredible how the community after that started supporting the shelter. Like donations were pouring, and not only like medical supplies that they could buy, or PPEs, or like monetary donations. Things were just coming. So don't be scared, be transparent, and that will help you in the long run. Step 6, while apparently healthy animals may be contagious, the greatest resource of transmission of those animals who are showing clinical signs of illness. For this reason, they must be isolated. Oops, sorry. They may be isolated from the general population, and strict biosecurity measures must be in place to prevent transmission from one animal to the other, from sick population to unexposed population. So you need to really isolate those animals and make sure that you are managing biosecurity, have very strict biosecurity. And do we always need to isolate every single disease we are talking about? Think about feline URI, right? Feline URI, it's one that isolating in place may be the best option when we have mild and moderate clinical signs. We're just going to isolate those severe cases. The ones we may want to test, those are the ones that we may want to isolate. Other than that, the movement of the animal from one housing area to another, from one enclosure to the next one, may increase stress to a level that the animals may develop even higher clinical signs. So with proper biosecurity, this cats with feline, like with URI, should be held in place. But before we go any further, we're gonna talk really quick about this: isolation and quarantine. We see a lot of people just using this term just as if it was the same thing. I've talked a little bit, but let's remember, isolation, it's for sick animals or suspected animals with active clinical signs. Even animals sometimes tested negative, but those clinical signs are telling you that animal has distemper and you have a distemper outbreak happening. So that those sick, positive animals or suspected are going to go to isolation. Quarantine is for exposed animals. It's just the animals that haven't been exposed, and they are on that, like you are waiting that incubation period to see if they are gonna get sick or not. So ideally, isolation is going to be on separate room. That's what you want, right? Like you're going to isolate, you're going to have a separate whole thing. Like that's the best way to go. But if that's not possible, or or you don't have any room that is equipped for a temporary housing, right? You can just create something within your shelter, like in the same room. You can there are different strategies to be using that. But for shelters that only have a single area for housing, you can just, a section of row can be the isolation, right? We were working with a kennel cough outbreak, and they have one room. Everybody was exposed, but some were have clinical signs. They were kept in one side and some were not. So they were kept in the other side in very strict biosecurity in between. It's and while shared ventilation is not ideal, the tarps may function as a physical barrier and will signal the staff the transition between one area and the other, right? Like it's really like if you don't have a physical tarp or something like that, just put a signage, just put like tape, red tape, yellow tape, whatever color is going to be that area. And also like lack of separated ventilation system, it's not a valid reason for neglecting to isolate sick pets, right? It's really like, it's not because I cannot do an ideal isolation that I will not do it at all. And maybe euthanasia is going to be the solution, which is not. There are many ways of making this happen. And again, all if sick animals cannot be isolated properly, all live outcome options and alternative housing must be explored. So we're really talking about you be creative, right? It's not because I cannot isolate. What are the options? Can I do foster to adopt? Can I do just foster? So that we're treating those animals out there. Is there an empty room? Is there a bathroom, right? Is there a rescue partner that will take those animals? And you will find those, right? So it's very important to be transparent about the situation, what's happening, be open, and just let those animals go, right? Like with the proper information, you can definitely do that. And we did talk about mild and moderate feline URI, so we just need to make sure that we are isolating them in place if it's mild or moderated. We've talked about that already. We don't want to be increasing stress and making them get even sicker. Step 7, treat and manage sick animals. Treatment is going to change right from place to place. It's going to change from your resources, from the diseases, everything, right? And here we have this QR code has it's a link to our protocols, but just think about it. It's about finding ways to isolate and treat them and maintain them in humane conditions. This is really like this is a treatment decision flow chart that we created, and it's also to guide staff, right? So just to help explain that collaboration, transparency, and problem solving can help guide whether to treat or transfer those animals, and only when it's absolutely necessary to euthanize. It empowers shelters to collaborate, explore creative treatment options, leverage the community support, and use clear protocols to protect both animal welfare and overall population health. So 8, quarantine exposed animals. We talked about what quarantine. It's for those animals that have been exposed to a pathogen, and we are waiting to see is that like during the incubation period if they're gonna get sick or not, right? So that's what quarantine is for, and it's very important to us to think about not every exposed animal may need to go to quarantine. There are ways of assessing that. There are ways of deciding, do I need to or not? So, and this is like an image that I showed before, but it's really just about like, this is how we end up creating this. The beginning, they had very few animals with kennel cough, with distemper. So we kind of created an isolation here. The green is the area for emergency intake. So it's as far as possible. And all of the other ones were exposed because they had like, they didn't have biosecurity at all, no using any kind of PPEs. Vaccination was poor, so we ended up like considering the whole population as exposed. So it's just that at that point, we like as they weren't vaccinated, we didn't have any history. We couldn't do anything other than that. But there are ways to select. Do I have animals that may be exposed but may be protected? Is there a way of assessing or doing a risk assessment, which is our step number 9, and really just to make sure that, oh, maybe if I have a dog that is an adult dog that has been vaccinated and I have proof of it and has been exposed after that vaccination, is that animal, does it need to be in quarantine? And what are the probabilities of that animal developing clinical signs, right? So by using age, vaccination status, and time of exposure, we can start doing a risk assessment to say, maybe these guys don't need to go there. So just think about it, canine parvovirus, right? It's a disease that is most common seen in puppies under 6 to 12 months of age. Though we quite often we have seen outbreaks with older populations and adults, particularly those with adequate vaccine history at the time of exposure, can often be considered of low risk and may be eligible for transfer adoption without any kind of restrictions. a large percentage of the dogs entering shelters do not have immunity to canine distemper and to parvo as well. But this is just one example, right? So they and many dogs need two vaccines, like or more than two, like depending on the age that you started the vaccination to achieve full immunity, full protection. So you need to look at that. Are they fully vaccinated at the time of the exposure? And it's really considering age and how many times they were vaccinated and the time in between. And there are other pathogens that which vaccines are not available. So depending, if we are talking about canine influenza, we don't have vaccine. Sorry, canine pneumovirus, we don't have vaccine. So definitely that was going to tell us if they have been exposed. They have been exposed. Titer testing, which is what Mel is doing here, can help identify immune individuals, but must be paired with the PCR testing. So in this case, especially when doing for respiratory panel, we're going to pair those and we're going to look into those responses to really determine if those animals are or not protected, if they can move through the system or not. And here is just an example of a chart, right, where we are compiling that information. This was really just done based on age and it was age, intake date, vaccination date, and time of exposure. We didn't do titer tests for these guys, but we end up we had 56 of the population, the whole population, that were low risk. And those guys can get out really quick, right? We don't need to hold them. And that decreases your population, helps with animal flow. And then we had 43 that are questionables because we don't know who gave the vaccine. So we're not sure if that vaccine, they said they were vaccinated, but we don't have proof and things like that. And then puts a question mark and we don't move them as easy. But definitely the low risk ones, let's get them out, right? Clearing animals from an outbreak, right? Like from treatment area or from quarantine block. It's very important to think about that. From quarantine, right? Once incubation period is done and there was no clinical signs, those animals are clear. However, if an animal that is near, like if you have a row of quarantine dogs and they have 10 of them, 9 of them didn't show clinical signs, but one did, like the clock starts counting every time you have a new clinical sign. So those animals getting exposed and exposed and exposed again. So we just keep prolonging that quarantine every time you have a new one there. But if you have it's been 14 days, no one had clinical signs, none of those 10 dogs have clinical signs, all of them are clear from isolation. And again, it's going to depend. We need to remember that piece of incubation period. The other part is going to be depending on after treatment, right? Parvovirus, panleukopenia virus. That is we know a predictable time of shedding after following infection. So we know that pets like dogs can be clear 14 days after the initial clinical signs of parvovirus, and for panleukopenia virus, it's really 21 days. So if they have recovered before that, especially the cats, right? If they normally they recover before those 21 days, they need to go. They cannot go back to the general population. They go to another room, in between. And for those, for most cases of canine and feline and respiratory, animals are minimally contagious. And especially after the resolution of clinical signs. Clinical signs are gone, it's very low risk of them infecting. But canine distemper is an exception. And it's because it can be transmitted in so many different ways. And also, especially urine, fecal, right? There is an active component there. We need to know that a dog to be cleared from isolation or from after treatment, in case of distempers, we need to follow, it needs to be at least 14 days after initial clinical signs. When we are doing the PCR tests, we need to test them and retest. We need to have 2 quantitative PCR tests that are decreasing those clinical signs, that are decreasing in quantity. So 2 that you have lower quantities of a PCR lower than the beginning, you can release them. And also you need to remember just that you may have some mild neurological signs, and that it's acceptable to release because those may take longer for them to be getting better. And for ringworm, one single negative DTM, 10 day at day 10 of treatment, it's good to let them go. And the outbreak, we almost ending here. I have 1 minute. And the outbreak and returning to normal operations, right? Typically, for full resolution to be declared, at least 2 incubation periods must have passed and no new cases. So it's really like you kind of give that time frame to say, okay, no one has had any clinical signs. We give that incubation period, and then we go back to normal operations, just open for everybody, celebrate that moment, and then you move forward. Sanitation. This is a chart that is available for you guys as well. And it's really talking about the different ones. The ones that work in shelter settings are rescue, trifectant or Vicram, and Wheezy Wash and bleach. Those are the ones that really work in shelter settings to destroy parvovirus, clonocopelia virus, the ones that are hardy in the environment. And there are some that are called parvosol that are in other names that may use parvo in the name, and they are quaternary ammonia compounds. Those are not reliable in shelter settings. So just think about that. And this is going to give you like contact time, shelf life, everything that you need to know on how you're going to use it. It's very important, no matter what the manufacturer says. It's extremely important to have two. Sanitation, it's where we want to do to kill all the pathogens, right? To kill all the hardy ones. So we need to clean, we need to scrub, we need to physically remove and degrease the area, rinse that, and then apply a disinfectant, because most of the disinfectants are going to be inactivated by organic material. So we need to do that cleaning and then disinfecting, and that's what's going to be really our sanitation process. This is what we call deep cleaning. Biosecurity, make sure we are using PPEs. Make sure we know what is the flow in our shelter, right? We are moving from healthy, unexposed, most vulnerable animals like puppies. Then we go to the adults that haven't been exposed. Then we go to quarantines, healthy ones. We go to quarantines of the ones that are least vulnerable ones. And then we go to isolation areas. So if we need to really think about what's the flow that I'm going to walk, what's the flow that I'm going to provide treatment, what's the flow that I'm going to give food, and so on and so on. Ideally, you're going to have separate staff for each stage. Vaccination, neonatal vaccination, that is out there. We are recommending, you have the link on the playbook as well. We are recommending neonatal vaccination with the HPP and FERCP day 0. And some of them will have 9 vaccines when they hit the 18 to 20 weeks of age. So it's really like every 2 weeks until then. Modified live vaccines are the ones that have the quickest response. Following shelter guidelines, which is every 2 weeks. Adults need to have a booster 2 weeks later. The adults and puppies, everybody, they get an intake or prior to intake, really day of intake, at the exact moment of intake preferably, and then 2 days later, adults need a booster, and puppies or kittens, they will have every 2 weeks until they hit the 18 to 20 weeks of age. And make sure that you're setting up, you storing your vaccines, handling properly, and you are also recording and setting reminders. And we're almost done here. We just need to remember number one reason, that there are 2 actually number 1 reasons, which is really overcrowding and prolonged length of stay. So proactive population management is the key here. And that will go with daily population rounds and pathway planning and reducing stress. Stress affects our immune response, or their immune response are able to fight diseases. So we need to use all the strategies to mitigate stress so we can help them to fight diseases. And quickly, identification. We also have this here for you guys. It's just like a chart to help, some pictures to help train staff so they can identify some of the infectious disease clinical signs right away, so they can get to help that quickly identification and start addressing the situation. And disease surveillance is what we said. We need to monitor. each year how many cases I have. We need to enter diagnosis on our softwares. We need to enter there so we can monitor what's happening, so we know, are we having or not an outbreak. Like this shelter, they were having an outbreak of ringworm here, and we just noticed really because I was collecting this data for something else, and then I was like, oh, what's going on? And it was really during that month that I was doing the data. Thank you so much. Sorry that it took me a little while, and I really need to speed up. It's a lot of information. Feel free to reach out to us. And the next slide is going to have those resources. But don't forget, next week we're going to have, like, we'll be talking about high quality, high volume spay neuter updates. It's going to be great for you guys. Some great quality information, and don't forget to join us not next week or the next month. And here you have. This QR code is with our playbook. If you need help, just reach out to us, or here you have our medical protocols. Thank you so much, and just reach out if you need anything.